Welcome back to our medical study 19. Today we are talking about a very common but often underestimated health condition, anemia. Have you ever felt tired all the time, dizzy when you standing up, or noticed your skin looking pale? These could be signs of anemia. Anemia is not just about low blood, as many people think, but it's a condition where your body does not have enough healthy red blood cells to carry oxygen to your tissues. And without enough oxygen, your body simply cannot function properly. Now, in this lecture, we are going to study about definition of anemia, classification of anemia, causes of anemia, symptoms of anemia, investigation of anemia, treatment and prevention. So, what exactly anemia is? In simple words, it means decrease in RBC count, hemoglobin or hematocrit values, resulting in a lower ability of blood to carry oxygen to the body tissues. Now, to study about pathophysiology, we have to study about some normal physiology of forming red blood cell or hemoglobin. Red blood cells are produced in the bone marrow through a process called erythropoiesis. The process is stimulated by a hormone called erythropoietin hormone, which is secreted mainly by the kidneys when oxygen levels in the blood are low. Each red blood cells lives for about 120 days, and it, its main job is to carry oxygen from the lungs to tissue and bringing back carbon dioxide. This oxygen carrying capacity comes from hemoglobin, a protein made of four chains, two alpha and two beta chains in adult. Each hemoglobin molecule can carry four oxygen molecule. For proper hemoglobin formation, we need iron for hema part, vitamin B12 and folic acid for DNA synthesis in RBC, a healthy bone marrow, and normal erythropoietin level. Now, to study pathophysiology of anemia, decrease in RBC or hemoglobin or hematocrit value result in diminished oxygen carrying capacity, which results hypoxia and hypoxia-induced effect on organ function, and the signs and symptoms of anemia are seen. Now, the normal values for hemoglobin in man is about more than 13 gram per del. For women, more than 12 gram per del. In pregnant women, it should be more than 11 gram per del. And infants from 2 to 6 months, it should be more than 9.5 gram per del. Children from 6 months to 24 months, it should be more than 10.5 gram per del. And 2 years to 11 years, it should be more than 11.5 gram per del. And children from 12 years of age, it should be 12 gram per del. Classification of anemia on the basis of cause and on the basis of morphology. On the basis of cause, it might be due to the blood loss or inadequate production of normal blood cells or excessive destruction of blood cells. On the basis of morphology, it can be further classified into normocytic anemia, microcytic anemia, and macrocytic anemia. Types of anemia based on clinical features, it can be classified as iron deficiency anemia, megaloblastic anemia, pernicious anemia, hemorrhagic anemia, hemolytic anemia. In hemolytic anemia, thalassemia and sickle cell anemia undergoes anaplastic anemia. Now, types of anemia. In types of anemia, iron deficiency anemia is due to the excessive loss of iron. Women are at risk for menstrual blood and growing fetus. Megaloblastic anemia is due to the less intake of vitamin B12 and folic acid. Red bone marrow produces abnormal RBC like in cancer drugs causes megaloblastic anemia. Pernicious anemia, inability of stomach to absorb vitamin B12 in a small intestine. Hemorrhagic anemia, excessive loss of RBC through the bleeding or stomach ulcers, menstruation may cause hemorrhagic anemia. Hemolytic anemia due to RBC plasma membrane ruptures may be due to the parasites, toxins, and antibodies. Thalassemia is due to the less synthesis of hemoglobin found in population of Mediterranean Sea. Also, sickle cell anemia. It is the hereditary disorder, blood disorder characterized by red blood cells that assume an abnormal rigid sickle shape. And aplastic anemia, it is due to the destruction of red bone marrow caused by toxins, gamma, gamma radiations, etc. Normochromic normocytic anemia or normal EMCSC and normal EMCV. These includes anemia of chronic disease, hemolytic anemias, those characterized by accelerated destruction of RBCs, anemia of acute hemorrhage, aplastic anemias, those characterized by disappearance of RBC precursors from the marrow. Now, hypochromic microcytic anemia, in which there is a low MCSC value, low MCV, and these includes iron deficiency anemia, thalassemia, and anemia of chronic disease. Now, normochromic macrocytic anemia or normal MCSC but high MCV values. These includes vitamin B12 deficiency and folate deficiency anemia. Now, types of anemia we can also see here. Hyperchromic means hyper means high, chromic means color. You can see here normal chromic in the figure and hypochromic. Also, this line indicates the macrocytic, hyperchromic macrocytic, normochromic macrocytic, hypochromic macrocytic. Similarly, in the middle you can see normocytic, and the fine parts you can see macrocytic anemia of all three types. Now, what are the risk factors for anemia? How anemia is developed? It is due to poor socioeconomic class, multiparity, teenage pregnancy, and menstrual problem lead to this disease. Now, what are the causes for anemia? The causes for anemia are in increased requirements or increased blood loss, decreased intake of or decreased absorption. In increased requirements, you can see menstruating females, pregnancy, lactation, growing infants and children, erythropoiesis results. And in increased loss, GI bleeding, menorrhagia, persistent hematuria, intravascular hemolytic anemia, regular blood donors, parasitic infection also are the causes for increased loss. What are the decreased intake for responsible for causing anemia are vegetarian diet and socioeconomic factor. And decreased absorption is due to upper GI pathology like celiac and Crohn's disease, gastrectomy, and medication such as antacid and Gentech causes anemia. Signs and symptoms of anemia. Now we are going to study about symptoms. What are the common symptoms of anemia? The first of all, easily fatigue and less of energy. Unusually rapid heartbeat, particularly with exercise, shortness of breath and headache, particularly with exercise, difficulty in concentrating, dizziness, pale skin, legs cramp, and insomnia. Anemia caused by iron deficiency. People with an iron deficiency may experience these symptoms like hunger for stained substance such as paper, ice, or dot, a condition called pica. Upward curvature of the nails, referred to as Colonychias, Colonychias, and soreness of the mouth with cracks at the corners. Anemia caused by vitamin B12 deficiency result. People whose anemia is caused by deficiency of vitamin B12 may have these symptoms like tingling sensation, pins and needle sensation in the hands or feet, lost sensation of touch, wobbly gait and difficulty walking, clumsiness and stiffness of the arms and legs, dementia, hallucination, paranoia, and schizophrenia. Now, what are the signs of anemia? We can see signs and symptoms. Signs are the objective finding by a doctor. Symptoms are the subjective complaints. We can differentiate how symptoms and signs are different from each other. Signs are the objective findings. Symptoms are the subjective complaints by patient. Now, The signs of anemia includes brittle nails, koilonchia, also known as spoon-shaped nails, here atrophy of the papilla of tongue, angular stomatitis, brittle hair, dysphagia and glossitis, plumber vision like Kelly Patterson, means decreased vision loss. You can see here the picture first. Here, hyperatrophy of tongue. You can see the skin color. Also, brittle nail and spoon-shaped nail. As already told, red in anemia, in red in severe anemia means fainting. If there is a severe anemia, there will be fainting, chest pain, angina, and heart attack. And in other symptom includes we can see from head to toes. In eyes are yellowing of eyes. If you see the skin of neck, you can say paleness, coldness, and yellowing, shortness of breath, weaknesses, changed stool color, fatigue, dizziness, low blood pressure, palpitation, rapid heart rate, and enlargement. Here, red color includes in severe anemia, means that are if there is a severe anemia, patient will undergo fainting, heart attack, angina, and chest pain. What are the investigation for anemia? The red cells population is defined by quantitative parameters and qualitative parameters. In quantitative parameters, volume of packed cells like hematocrit value, hemoglobin concentration, and red cell concentration per unit volume are identified. And qualitative parameters, mean corpuscular volume (MCV), mean corpuscular hemoglobin (MCH), and MCSC, mean corpuscular hemoglobin concentration are tested in the lab. Hematocrit or packed cell volume. It is the proportion of the volume of blood sample that is occupied by RBCs. In men, about 40 to 52%, and in women, it should be about 36 to 48%. Cell volume hemoglobin concentration. It is the amount of hemoglobin per unit volume of blood, GM per del. In women, it should be 12 to 16 gram per del, and in men, it should be 14 to 17 gram per del. And red cell count. Total number of red cell per unit volume of blood sample should be number of RBC per cubic mm. In men, 4.2 to 5.4 uh, into 10 to the power 6 mm cube. In women, it should be 3.6 to 5.0 into 10 to the power 6 mm cube. Mean corpuscular volume. It is the average volume of uh, RBC. Also, its unit is femtoliter. Normal, it should be 80 to 98 mm of cube or 80 to 98 femtoliter, also known as mean corpuscular hemoglobin. It is the average hemoglobin content per RBC. Normal value is 27 to 31 PL. And mean corpuscular hemoglobin concentration MCSC, it is the average concentration of hemoglobin in a given red cell volume. Normal ranges from 32 to 36 gram per del. Now management. You have care objectives. Determine the cause of iron deficiency. The etiology is often multifactorial, even when there is an obvious cause. Investigation of serious underlying causes, example cancer in adults, results in anemia is recommended. And aim of treatment: normalize hemoglobin levels and red cell indices, replenish iron stores, and individualize disease-specific management depending on underlying cause. And lifestyle management includes recommended the patient with iron deficiency receive dietary advice should be given to the patient. And non-pharmacological management. In non-pharmacological management, tea and coffee inhibit iron absorption when consumed with a meal or shortly after a meal. Vitamin C or ascorbic acid is also powerful enhancer of iron absorption from non-meat foods when consumed with a meal. The size of the vitamin C effects on iron absorption increases with the quantity of vitamin C in the meal. And germination and fermentation of cereals and legumes improves the bioavailability of iron by reducing the content of phytate, a substance in food that inhibits iron absorption. Also promote and support exclusive breastfeeding for about 6 months followed by breastfeeding with appropriate complementary foods, including iron rich through the second year of life. Recommended dietary allowance mg per day for men adult 80 mg per day, for women adult age of 51 80 mg per day, for adult age resulting from 19 to 50 80 mg, pregnant woman 27 mg, for lactating woman 9 to mg to 10 mg, adolescents age from 9 to 18 girls and boys, for girls 8 to 15 mg, for boys 8 mg to 11 mg per day should be taken. And children birth at the age of 8 age of 4 to 8 10 mg, infants 7 months to 1 year 11 mg, and infants birth to 6 months 0.27 mg should be taken. Now, new patient one new patient workup to determine anemia etiology. Then whether it is iron deficiency anemia, if yes or no. If yes, then dorming, that was iron or iron, yes. IV iron should be given or oral iron. In IV iron, monitor iron status and administer treatment as necessary. For oral iron, meeting goals for efficacy and compliance. If there is no, then IV iron can also be given. If the patient is intolerable to oral iron, then it can be given as IV. And iron deficiency anemia, if there is no, then further evaluation of etiology. What are the causes? Test for anemia often includes CBC, MCB, reticulocyte count, serum creatine, TIVC, TSAT. Now, management. Complementary parasite control measures. Antihelminthic therapy with 400 mg of single doses of albendazole is given to eliminate hookworm before the initiation of iron and folic acid therapy. Child less than 2 years can be given as 200 mg per day single dose, and in pregnancy, albendazole is contraindicated in first trimester and can be administered in second or third trimester. Treatment for 6 to 24 months. Dosage, birth weight, category, and duration. Dose 12 to 5 mg iron plus 50 mg folic acid daily should be given if the normal weight birth weight is normal, and the duration of 6 to 24 months of age. And low birth weight means with the baby about less than 2500 gram, it should be 2 to 24 months of age. Treatment of mild and moderate anemia. Group and doses. Children year of 2 to 5 years, 20 to 30 mg iron. Children belonging from 6 to 11 years, 30 to 60 mg iron, and adolescent and adult, more than 60 mg iron should be given. Anemia will correct within 2 to 4 months if appropriate iron doses are administered and underlying cause of iron deficiency is corrected. Continue iron therapy as an additional 4 to 6 months for adults after the hemoglobin normalizes to replenish the iron stores. Treatment for severe anemia. For age group of less than 2 years, it should be given with 25 mg iron plus 100 to 400 mg folic acid daily for the duration of up to 3 months. The age ranges from 2 to 12 years. It should be given 60 mg iron with 400 mg folic acid daily up to 3 months. And adolescents and adults, including pregnant women, should be given 120 mg iron plus 400 mg folic acid daily up to 3 months. After completing 3 months of therapeutic supplementation, pregnant women and infants should continue preventive supplementation program. Now, treatment of pregnant women, it continues. Prevalence of anemia in pregnancy, dose and duration. About 40% of population are caused anemia. Dose 60 mg iron plus 400 mg folic acid daily up to the 6 months in pregnancy and continuing to 3 months postpartum. Iron absorption may be decreased by antacid or supplements containing albumin, magnesium, calcium, zinc, proton pump inhibitor. Space administration apart by at least 2 hours. Oral iron preparation may cause nausea, vomiting, dyspepsia, constipation, diarrhea, or dark stool. Strategies to minimize these effects include start at lower doses and increase the gradually over 4 to 5 days, giving divided dose or the lowest effective dose, or taking supplements with a meal. Although sustained release in iron preparation tends towards the less gastrointestinal side effect, they may not be effective as standard film coated products due to reduced or poor iron absorption. Now, what are the benefits of therapy, iron therapy, population group, and benefits in children? Improved behavior and cognitive development, where the anemia is common, improved child survival. In adolescents, improved cognitive development. In girls, better iron store for later pregnancies. In pregnant women and their infants, decreased low birth weight, where severe anemia is common, decreased maternal mortality and obstetrical complication. In all individuals, the benefits of therapy are improved fitness and work capacity, improved cognition. Thank you for your patience. And so, friends, anemia is common but not something to ignore. It affects millions of people worldwide and can silently damage the body if left untreated. The good news is, with proper diagnosis and treatment, the most of anemia can be managed or even completely cured. If you or someone you know has symptoms like persistent fatigue, pale skin, or frequent dizziness, don't ignore it. Get tested, stay healthy, eat a balanced diet, and spread awareness about anemia. This was today's video from Medical Study 19. If you found it helpful, please like, share, and subscribe to our channel for more easy explanation of medical topic. Thank you for watching and see you in the next video.